This podcast is for informational and educational purposes only. It is not medical advice. Always consult a qualified healthcare professional before starting, changing, or stopping any treatment, including peptide use. When people first start learning about peptides, one of the most common questions is where on the body they can actually inject them. It might sound simple, but placement matters more than most realize. The location affects absorption, comfort, and even how consistently the peptide works over time. So let's spend this episode exploring the most common injection sites, why they are used, and how to think about rotating them for safety and effectiveness. Let's begin with subcutaneous injections, often called subinjections. These are the most popular method for peptides because they are relatively easy, less intimidating than intramuscular shots, and can be done at home with small insulin syringes. Subcutaneous means the peptide is delivered just under the skin into the fatty tissue. This allows for slower, steady absorption, which many peptides benefit from. The most common area for subcutaneous injection is the abdomen. Typically, people inject in a circle around the belly button, at least 2 inches away from the navel. This area is popular because it's easy to see and reach, and the skin there usually has a good amount of fatty tissue, making the injection comfortable. Rotating around the belly ensures you don't overuse one single spot. Another frequent site for subcutaneous injections is the thigh, specifically the outer area of the upper leg. Many people like this option because it's also easy to reach when sitting down. The skin here tends to be slightly firmer than the abdomen, so sometimes it can be a little more noticeable when the needle goes in. But it's still a reliable, safe site with plenty of fatty tissue. The upper arm, especially the back portion where there is a bit more fat, can also be used. Some people find this area a little harder to reach on their own, so it's often easier if someone else helps. If you're self-injecting, you might prefer the abdomen or thigh for convenience. The flanks or love handles are another option. This area, just to the side of the abdomen, provides a little variety when rotating injection spots. Rotation is important because if you use the exact same spot repeatedly, the tissue can become irritated, bruised, or even form small lumps. Changing spots each time helps protect the tissue and allows for more consistent absorption. Now, let's shift briefly to intramuscular injections, also called IM injections. While not as common for peptides, some people do use them for specific compounds. Intramuscular injections deliver the peptide deeper into the muscle, where it absorbs more quickly than in fatty tissue. The common IM sites are the deltoid in the upper arm, the gluteus muscle in the hip, and the vastus lateralis in the thigh. These injections require a slightly larger needle and a bit more precision. So why choose subcutaneous over intramuscular, or vice versa? It often comes down to the type of peptide and how it is absorbed. Many peptides are designed to work best with slow, steady release, which makes subcutaneous injections ideal. However, some peptides may be delivered intramuscularly if faster absorption is desired or if recommended by a healthcare provider. No matter which method is used, comfort and safety are critical. Always clean the injection site with alcohol before inserting the needle. Pinch the skin gently if you are doing subcutaneous injections. Insert the needle at about a 45 to 90 degree angle depending on needle length and skin thickness, and inject slowly. Afterward, dispose of the needle properly in a sharps container. Another important factor is timing. Some people prefer injecting in the morning, others at night, and some split their doses depending on the peptide. But regardless of the time, the injection site rotation remains important. Imagine creating a small grid around your abdomen and thighs. Each day, you move to the next square in that grid. This ensures each spot gets plenty of rest before being used again. For those new to peptide injections, a common concern is pain. Most of the time, subcutaneous injections with small insulin syringes are barely noticeable. Occasionally, there may be a slight pinch or a bit of burning if the peptide itself is acidic or if the injection is done too quickly. Injecting slowly and letting the liquid settle can reduce discomfort. Some peptides are more likely to cause irritation at the site. If you notice redness, swelling, or persistent pain, it's worth noting the location and adjusting next time. Sometimes simply choosing a different area or rotating more frequently solves the issue. Staying relaxed and breathing steadily also makes the process easier. Let's walk through a step-by-step example using the abdomen. You would wash your hands first, then take an alcohol swab and clean a spot about 2 inches to the side of your belly button. Let it air dry for a few seconds. Drop the peptide into your syringe, making sure you have the correct dose. Pinch a small fold of skin between your fingers. Insert the needle quickly at about a 90-degree angle if you are using a very short insulin needle, or 45 degrees if you are thinner, and using a slightly longer one. Push the plunger slowly until all the liquid is in. Remove the needle smoothly, release the skin, and lightly press the spot with a clean cotton ball if needed. Then safely dispose of the needle. That's it. The whole process takes less than a minute once you are comfortable with it. With practice, it becomes a simple part of the daily routine, much like taking a vitamin or brushing your teeth. It's also helpful to remember that everyone's body is a little different. Some people have more fatty tissue in certain areas, some find one location more comfortable than another, and some respond differently, depending on the peptide. It's okay to experiment within the safe zones to see what feels best for you. Another tip is to store your peptides correctly. Keeping them refrigerated when required and reconstituting them properly ensures you're injecting something stable and effective. And always use new, sterile needles. Never reuse them. Over time, you'll notice patterns. Perhaps you prefer the left side of your abdomen in the morning and the right thigh at night. Maybe you create a rotation schedule that covers 8 different spots before repeating. These little systems make the process smoother and keep your skin and tissue healthier. One final note is mindset. For many people, injections can feel intimidating at first. But with calm, consistent practice, it becomes second nature. Remind yourself that you are taking an active step in your health journey and that this small, quick process is helping you pursue your goals. This podcast is for educational purposes only and is not intended to replace professional medical advice. Always consult your healthcare provider for guidance specific to your situation. Thanks for listening, keep learning, and stay curious.